needs-based strength and conditioning. I'm going to show you a quick assessment you can do for your hip, and then I'm going to show you a quick corrective strategy you can do to help improve your hip range of motion. So what we're going to do is you're going to line your back. We're going to go palms up, shoulders down, feet together. You're just going to lift one leg as high as you possibly can. What we're assessing to see is if we can pass the midpoint of our thigh. So a lot of the older adults that come in here and some of the younger athletes, when we're coming up, they're barely able to get their leg off the ground. And in some instances, they're able to get one leg way up and the other leg way off the ground. So what that is they have an imbalance in their hip complex. So there could be tight hamstrings, could be tight hip flexors, pelvis out of alignment, weak core. There's a lot of different things that are going to cause the hips to be out of whack. But you want to be able to assess to make sure that they're pretty balanced. And then you want to be able to make sure you can move optimally before you start going into squats and deadlifts, cleans. Could be just a simple med ball squat with an older individual. If you have an imbalance, you're going to create a little bit of a twisting. Once you hit your end range, you're going to be restricted and stop. Or if you have an imbalance, you're going to create a twist. That's not good for the knees. That's not good for the hip or the lower back. And in sport, that could be an injury pretty quickly. Doing some physical activity out in the backyard, just bending over and picking up a rock or something in the garden and moving a wheelbarrow, that could be an injury pretty quick. So do the assessment, see if you're balanced on both sides, see if you can move through an optimal range of motion. Key point to that is the back leg stays flat, toe stays pointed straight ahead. So if you notice that there is an imbalance or you notice that there is a weakness or a restriction, tightness of some sort, the quick fix is to grab a rope or band or belt, towel, anything of that nature. You're going to hook around your foot. You're going to lie on your back. So we're going to pull this knee to chest to get started, leg extended. So now both legs are at that 90 degree or kind of where the range that you can get to. Shouldn't have a crazy stretch here. You should feel a little bit of a stretch. You're going to hold on to this tight, shoulders are back. You're going to exhale as you drop. You're going to start to feel potential stretch here, and then we're going to engage our abdomen, pull back up. Right, so you do this about 8 to 10 times. If you're struggling with your range, you can put a box or a ball so it kind of stops you so you don't have to go all the way down. If you're noticing that you can't keep your core engaged and you're getting a big lift in your lumbar spine there, that can cause some back pain. So you're just going to shorten the range. So we just start at the top, drop down, do about 6 to 8 on one side, switch, 6 to 8 on the other side. You can progress the reps there or progress to a full range of motion. That's going to help loosen up what needs to be loosened up, strengthen what needs to be strengthened. We're not really worried about what it is, but we want to be able to get through an optimal range of motion, make sure that that hip is functioning properly. So we go into exercise and physical activity, we're less likely to get injured.